Hello students and welcome to the part 2 of most anticipated MCQ series of forensic medicine. We are running this series for all those students who are due to appear in the forthcoming NEET PG examination in June 2024. Right, let's take up the first question of part 2. So the question is, a victim suffers a laceration on his forehead upon being attacked by a wooden stick by an unknown attacker. He also has a broken frontal bone beneath. So, what do we have? We have attack leading to laceration on the forehead and a broken frontal bone, right? During his forensic assessment, a senior asks a junior doctor regarding the type and mechanism of production of the injury. What would be the correct answer? So, question is not talking anything about the laceration or the broken frontal bone. The question is really about the type and mechanism of production of injury. Let's read the options. It's an avulsion laceration due to peeling away of the skin, or it is a cut laceration due to force from heavy object, or it is a split laceration due to persisting pressing of skin between two blunt surfaces, or it is lacerated looking incised wound due to cutting of the skin. Right? So we have four options available. Now, first and foremost, the concept on which this question is based. This concept has been repeatedly asked in examination multiple times. Multiple times means multiple times. High chances that this question or this concept may be repeated in the forthcoming examination also. And what is the concept here? The concept here is understanding of incised looking lacerated wound, right? If you look at the fourth option, option D, that is lacerated looking incised wound. Basically, it's an incised wound which looks like a laceration. But here we are talking about a concept called as incised looking lacerated wound, which means actually it's a lacerated wound, but it looks like an incised wound. These kind of wounds can be seen on bony prominences of the body. So if a person is hit by a blunt weapon on a bony prominence of the body and that skin lacerates, upon primary inspection, it looks to be an incised wound. These are called as incised looking lacerated wound. And why does this phenomena happen? Because when this happens, that is a blunt weapon hits on the bony prominence of the body, the skin gets pressed between two blunt surfaces. So one blunt surface is the weapon which is hitting the area of the body from the top, and the other blunt surface is the bone underneath the skin itself. Because there is a bony prominence, there is lack of connective tissue. So the underneath bone provides a base between which the skin gets pressed and it splits open. And whenever this splitting phenomena happens, the margins of the wound are very, very regular, and thus, upon primary inspection, it may look like an incised wound. Right? This concept has been asked in the examination multiple times, and understanding of this concept now tells us that the correct answer in this situation is option C, that is split laceration, right? It is split laceration. Remember, if in our examination any such question come or a photograph come where there is a wound which is present on the bony prominence of the body, read the question very, very carefully, because the examiner may be wanting to know that whether you know something about incise looking lacerated wound or not. Right? Now, let's see uh, what are some important lacerations and how they commonly happen on the body. So, one is avulsion laceration. Here, the skin plus subcutaneous tissue may get removed from underneath muscles and tendons, thereby exposing those muscles and tendons. Right? Commonly, this kind of removal of skin away from the muscles and tendon may be caused by a heavy rolling force. Okay, so these are commonly seen in heavy rolling forces acting on the body. Right? The next one is cut laceration. It is produced by heavy cutting weapon like an axe. Okay, the hallmark of a cut laceration will be because a heavy blade of axe will be falling on the body. The margins will be contused, so it shall have contused margins. Then third is split laceration. We have already talked about split laceration in the question itself. It is pressing of skin between two blunt surfaces, right, seen on bony prominences of body. And remember, as we learnt in the MCQ itself, it is called as incised looking lacerated wound. Okay, and then we have another kind of laceration which is called as stretch laceration due to stretching of skin beyond its elasticity. So these are four lacerations, out of which avulsion laceration can be asked in the examination, cut laceration may be asked in the examination, split laceration may be asked in the examination. Stretch laceration is something which does not have any uniqueness to it. That is why it is not been asked in the examination. Okay. So remember, avulsion, cut, and split lacerations very common. But out of the three, the laceration which is asked excessively in the examination, that is split laceration, which is most common, so very important. Right? Let's take up the next question now. So next question is, a person falls from height and dies. He has some injuries on his body due to blunt force impact. Upon opening the skull, a characteristic fracture is noted, proving that it's a case of fall from height. what is the fracture? So question is very simply asking that if there is a person who has fallen from height and has died, what kind of a characteristic fracture can be observed in his skull, which can lead to the diagnosis that it looks to be a death due to fall from height only. Now that kind of fracture is called as ring fracture. Okay, ring fracture. Okay, let me show you a photograph of ring fracture. So ring fracture looks something like this. So if you'll see in this photograph, what do we see? In the base of skull, the fracture surrounds all around the foramen magnum, right? We can see the fracture line running in the posterior cranial fossa, as you can see here, all around the foramen magnum. So if I were to draw the base of skull, right? So this is the posterior cranial fossa in which we have foramen magnum right here, and if there is a fracture which is surrounding the foramen magnum like this, it is called as ring fracture. Now the fracture may not be surrounding foramen magnum completely. The fracture line may be seen around the foramen magnum incompletely, like this. It is still called as ring fracture. It doesn't have to be complete ring all the time, right? Now why this ring fracture generate in fall from height? Because when a person falls from height and he lands on his feet or on his buttocks, the force of landing is transmitted through his vertebral column, which goes and hits the base of the skull, because base of the skull is resting on that vertebral column, right? And that force leads to cracking of the bone all around the foramen magnum, known as ring fracture, pathognomic of fall from height. Okay, so that's one fracture in the skull that we understood. Let's understand one more fracture, which is often talked about when we talk about injuries to the skull, and that is called as a hinge fracture. Okay, what is a hinge fracture? A hinge fracture is a fracture which is seen in the middle cranial fossa, right, running from one end to the other. As you can see in the photograph itself, we can see a fracture line in the middle cranial fossa going from this kind of fracture line going from left through the body of sphenoid onto the right hand side of the middle cranial fossa, thus creating a divide in the base of the skull. So base of the skull is divided into two halves, an anterior half and a posterior half. The vault is intact. The vault is intact. So the skull is intact from the vault but is divided from the base. It is kind of hinging with an intact vault. That's called as a hinge fracture. Okay, because these kind of fractures are observed in lot of people who are driving two wheelers, who wear helmets if they unfortunately meets with an accident. That is why this fracture has another name called as motor cyclist fracture. We are given another name called as motor cyclist fracture, right? Okay, let's see yet another kind of fracture. a very important fracture, but very seldom has been asked in the examination. But yes, theoretically it is very important. This is called as a depressed fracture. Okay, first of all, have a look of uh, how depressed fracture looks like. So in the photograph you can see that this area has fracture of the vault of the skull, where the bone is cracked into multiple pieces. You can see the cracked ectocranium, right, all around here, and this cracked ectocranium is getting depressed into the endocranium, right. This kind of a fracture is produced by heavy blunt object having a small striking area. So heavy blunt object having a small striking area like a hammer. Okay, like a hammer. So if we are going to hit with a hammer, what is going to happen? The circular small portion of the hammer is going to hit at a particular curvature of the skull. In that hitting portion, that is in the circular fragment of that hammer, all the striking force will be delivered. That will end up cracking the ectocranium and causing the ectocranium to get depressed into the endocranium in that circular hitting portion of the hammer only, and that's called as depressed fracture. So what is the medical legal importance of depressed fracture? We can identify the weapon of offense because the fracture takes the shape of the hitting portion of the weapon, and so these fractures are also called as signature fracture. We are also called as signature fracture, right? Now coming on to yet another very important kind of injury seen in skull due to bullet entry into the skull, called as beveling of the skull. This is something which has been asked recently in INICT examination also. So there are high chances some part of or some format of this question may again appear in the NEET PG examination. So let's see what is beveling of skull caused by a bullet. Consider this to be the curvature of skull. So it has an ectocranial portion, the bone is thick, so ectocranium and endocranium. And let's say a bullet is coming and it is hitting the skull in an attempt to enter into the cranial cavity. And this bullet is revolving on its axis also, because when we fire a rifled firearm, it comes revolving towards the target. So when this bullet is going to enter through the cranial bone, it's going to drill through the cranial bone. But that hole, the drill of the bone is going to create a hole into the cranial bone. That hole is not equal outside and inside. So when the hole happens something like this. The outside hole is small and it is neatly punched out kind of an appearance. The inside hole is larger. So the track appears something like this, where you can see the outside hole small outside hole, and you can very easily see large inside hole created by a bullet entering into the skull, which has a telescoping margin inwards. So the margins are telescoping inwards inside the cranial cavity. Now this is called as beveling in of skull, right? So what would be beveling out? The reverse phenomena will happen if a bullet is exiting the skull. So when the bullet will be exiting the skull, what will happen? It will hit the endocranial portion of the bone first, creating a small punched out neat hole in the endocranium, and there will be a bigger hole in the ectocranium. So if you will see that phenomena, it will look something like this. So let's say this is the curvature now, right? So this inner hole is small, outer hole is large. Small inner hole, large outer hole. Now this is called as beveling out, or beveled in margins, or you can say beveled out margins. So beveling in will be seen in entry wound into the skull. Beveling out will be seen in the exit wound in the skull. So correct recognition of beveling can tell us whether the hole in the skull is an entry wound or an exit wound. This concept was asked in a pictorial format in this year's INICT examination also, right? Okay, let's move to see our next question. Next question is, a pedestrian is hit by a car while crossing the road. After being hit by the bumper of the car, he falls over on the bonnet, rolls over, and then falls on the ground. He develops multiple grazed abrasions on the left side of his body. The correct statement regarding the injury is, the options are, provided by the bumper striking the body during secondary impact, or grazed abrasions developed during the tertiary impact, or these abrasions are outcome of victim falling on the car, or grazed abrasions are outcome of primary impact injury. So four options are given. You know, to answer this question correctly, first of all, we need to understand all the phenomena that happen during a road traffic accident. And the situation is that there is a pedestrian who has been hit by a moving vehicle. So let's understand that phenomenon. So consider this pedestrian who is being hit by the moving vehicle. As the car comes and hits the pedestrian, whatever injuries he suffer on his body because of the primary hitting of the car on the body is called as primary impact injury. So what do we see here is primary impact injury. Now, what are the vulnerable portions of the body which are going to develop injuries due to primary impact? The vulnerable portions of the body will be legs, or you can say lower limb, right? As you can see in the photograph also. Okay. One very important primary impact injury is called as bumper fracture. A very important primary impact injury is called as bumper fracture, because the bumper of the car comes and hits the lower limb of the pedestrian and his lower limb bone gets fractured. Which lower limb bone fracture is most common in bumper fracture? It is tibia. Okay, so these four things have to be understood. Now what is going to happen? This hitting of the car on the lower limb of the victim is going to cause the victim to dislodge from the ground, and the victim may fall on the car itself, as it is seen in photograph number 2 here. And as the victim falls on the car itself after getting dislodged from the ground, whatever he suffers on his body is called as secondary impact injury. Now what will happen? The car will go forward with the momentum, and the person who has fallen on the car, he might roll on the car and then fall back to the ground. As the person falls back onto the ground with the motion or the momentum that he has gained because of the hitting of the car, he slides on the ground. That's when he develops lot of grazed abrasion because ground is the rough surface, right? He now his body hits some structure on the ground. His head may hit the road, his chest may hit a lamppost, or he may come actually under some other vehicle which is coming from behind. So possibly there are multiple ways of gaining lot of external and internal injuries in this situation. This situation is now called as tertiary impact injury, or you can call it plain and simple secondary injury. So either you call it tertiary impact or you call it plain and simple secondary injury, right? Now this is the time when majority people most commonly develop multiple grazed abrasions on body. Okay, and this is the time when majority develop fatal injuries. So tertiary impact is responsible for generation of majority of fatal injuries in RTAs and majority of grazed abrasions or external injuries on the body, right? Now with this knowledge, if we come back to our question, what do we see? The question was asking the correct statement regarding the injury, and the correct statement regarding the injury is that the grazed abrasion developed during tertiary impact, because in the question what is being asked, what is the correct statement regarding injuries, and what injuries has he suffered? He has suffered multiple grazed abrasions on the left side of his body. So correct answer here is option B, right? Okay. Um okay, let's now move on and let's see what else do we want to see in the situation of RTA. There is a very important table that you should remember. This question hasn't been asked for some time now in examination, but it's a very important aspect of forensic identification in the post-mortem time period. See, in the previous question we talked about uh, a pedestrian being hit by a moving vehicle. Now consider there are people sitting in the car and the car meets with an accident. So due to the hitting of the car or the car having an accident, the people who are sitting inside the car, they are also going to suffer certain injuries on their body. So let's say there are multiple people sitting in the car. So there could be three different categories of such people. One definitely is driver. Second is a front rider, the person who's sitting, besides the driver in the front seat. And third is the category of back seat rider or back seat passenger. Okay, so what kind of injuries these people may suffer individually on their body if the car meets with an accident? The first is seat belt injury. So driver and front rider are two people who are going to wear seat belt, and as the car is going to meet any collision because of their motion of their body, because of that collision, the seat belt will be compressing their body, resulting in generation of contusions, oblique contusions on their chest and the abdominal wall. So driver will have contusion, yes. Front rider will have contusion, yes. But these contusions may not be seen in the back seat passenger because generally they do not wear seat belts, right? But how to differentiate whether the contusion of the driver from the front rider? In driver, the contusion will run from right shoulder to left groin, as you can see written on the PPT right now. And in front rider, the contusion will run from left shoulder to right groin. So you will be able to distinguish who could have been driver or the front rider. Then second is dashboard injury. Dashboard after collision may be pushed inside the cabin, resulting in fracture of knee and posterior dislocation of the femur, because both the people who are sitting in the front will be impacted by the dashboard from the front itself. Thus, these two injuries may be seen in driver and front rider, but not in posterior seat passenger. Third is steering wheel impact, because steering wheel is only one. It is going to be impacting the driver only, resulting in concentric or circular shape contusions on the chest and abdomen, and maybe the impact can fracture the ribs also. So that's one thing which is only going to be seen in driver, because it will not be seen in the front passenger and it will not be seen in the posterior passenger also. Then next is whiplash effect. Whiplash effect on the neck because of the restraint of the body by the seat belt. Because two people are expected to be wearing seat belts, so whiplash effect on the neck are expected to be present in the front sitting people, but not in the back seat person. And last is windscreen effect. When the windscreen breaks due to the collision of the car, it breaks into very small pieces of glass, very fine pieces of glass. These pieces of glass may fly and hit the exposed portion of the person who are sitting in front, that is the driver and the front seat passenger, resulting in these kind of triangular cuts on their faces. These triangular cuts or small lacerations due to the glass pieces are called as sparrow foot lesions. So sparrow foot lesions are expected to be seen in driver and front rider, but again not in the back seat passenger. So these are few things that we need to remember, and questions can be asked accordingly from this aspect of the road traffic accident also, right? Okay, let's now take our next question. Next question is, a dead body is recovered from water. It has soft, moist, whitish development all around the skin. The body is greasy to touch, and the body is greasy to touch. The incorrect statement regarding the decomposition is. So first of all, after reading the question, we need to identify what is the kind of decomposition that is happening here. See, the body is recovered from water. So the body has been in a moist area. And what kind of decomposition happens in moist areas? We see development of adipocere, also called as saponification, right? And then when you correlate with the finding, it is soft, moist, whitish development, which is greasy to touch. They are all highlighting points of a fresh adipocere. Okay, so this is a dead body with generation of adipocere. The incorrect statement regarding this decomposition is, it is due to hydrolysis and hydrogenation of body fat. That's a correct statement. In adipocere, actually, the body fat breakdowns into fatty acids, which are further combining with ammonium and chloride ions of the body to form soaps. Okay, that is why it is also called as saponification, right? It develops in damp, warm environment Absolutely correct, right? Third is in India, it may start as early as 4 to 5 days after death. This is also a correct statement because most of the time when students read about adipocere, we say that the common time of appreciating adipocere is 3 weeks to 3 months, the common time of appreciating. But in India, where the temperatures are high, it's a country where it's not very cold. Adipocere development beginning may happen in 4 to 5 days. It may start to develop as early as 4 to 5 days. Right? The fourth option is that it has no smell. Now that's a wrong option because adipocere tends to have sweet smell. Like the common methodology of decomposition of body in normal climate is putrefaction. Putrefaction tends to have foul smell, right? In warm and moist environment, the body may develop adipocere. Adipocere has sweet smell, and in dry environment where the air is completely dry, devoid of any moisture, like in deserts, the body may decompose by rapid dehydration because the dry air is picking up the moisture away from the body. That decomposition is called as mummification. Mummification has no smell. Okay, so remember this point. Putrefaction, foul smell, adipocere, sweet smell, mummification, no smell, right? So these are important things that should remember when we talk about post-mortem changes. Another very important area of post-mortem change is fixation of post-mortem staining. Now, a lot of students know what is post-mortem staining. It is the gravitational pull of the stagnated blood after death towards the dependent part of the body. Wherever the post-mortem staining develops, after looking at it, we can say what would have been the dependent area of the body. So it helps in identifying the position of the body after death. But post-mortem staining also helps in identifying time since death. Let's see how. So if you first of all look at this photograph here, what do we see in this photograph? That this discoloration is very well seen on the area of the body which is post-mortem staining. And when somebody is pressing with his finger in the center of the discoloration, this area, because of the pressing of the finger, is getting pale. Right? You can see in the center it's getting pale. Why? Because the discoloration, which is post-mortem staining, it is not yet fixed to that area. If that discoloration would have been fixed to that area, even upon pressing with the finger, the discoloration would not get shifted from that area. This concept is called as fixing of post-mortem staining. So, once the post-mortem staining develops at the dependent part of the body after death, and if the body remains in that position for certain number of hours, the post-mortem staining starts to get fixed to that area. Now, the fixing process of post-mortem staining begins at 6 hours after death and it is completed by 12 hours. Right? What are we talking about? We are talking about fixing. of PMS. So fixing of PMS begins at 6, completes at 12. So if you look at this table now, we have three different time zones. The first is 0 to 6 hours. In 0 to 6 hours, the postmortem fixing of postmortem staining does not begin. So there is no fixation of postmortem staining. As a result, if somebody is going to press the area, what will be observed, that will be complete shifting of the postmortem staining from the area or at the area upon giving pressure. Now this is called as pressure test. So if you do a pressure test and the area becomes pale completely, it means it is within the first 6 hours after death. What will happen between 6 to 12 hours? Now that is the time when the post-mortem fixing, staining fixing has begun but is not yet completed. So we say we can observe partial fixation. As a result, when the pressure test is going to be done on this body, what will we observe? We'll observe partial shifting only, not complete shifting, partial shifting, right? And what will be seen in greater than 12 hours? The PMS fixation should be complete. So there should be no shifting observed on pressure test. So depending upon after pressure test, if you are observing shifting, we can say whether the body has died in between 0 to 6 hours or it is 6 to 12 hours or more than 12 hours. That is how PMS can help in determination of time since death. Let's take the next question. Okay, all the children are legitimate to a male. All the children are legitimate to a male except. Now, what is this legitimacy? In simple words, if I have to say legitimacy, legally, legally all biological offsprings of a male are heir to his प्रॉपर्टी. यानी कि हिंदी में अगर हम कहेंगे that all the children which are biologically born to a male will become automatic higher of his property, will become उसकी प्रॉपर्टी के इक्वल हिस्सेदार हैं वो. इस कॉन्सेप्ट को कहते हैं लीगल लेजिटिमेसी. ओके, द ऑप्शंस व्हिच आर गिवन इन द क्वेश्चंस आर supposititious child, posthumous child, birth following an artificial insemination, both A and C. हमें ये बताना है कि कौन से बच्चे लेजिटिमेट नहीं हैं, यानी कि आफ्टर देयर बर्थ वो ऑटोमेटिकली एक मेल के प्रॉपर्टी के हिस्सेदार नहीं होंगे बिकॉज वो लेजिटिमेट नहीं है. ओके, so what is supposititious child? Supposititious child is a child which a female proclaims, right, that a person has impregnated her. यानी कि एक फीमेल है वो प्रोक्लेम कर रही है that there is a male who has impregnated her and the child belongs to him, जबकि ऐसा हुआ नहीं है. यानी कि वो चाइल्ड जो है वो फादर का या मेल का बायोलॉजिकल ऑफस्प्रिंग नहीं है. इसको बोलते हैं सपोजिटिशियस चाइल्ड. तो सपोजिटिशियस चाइल्ड लेजिटिमेट होगा क्या? ये नहीं होगा. दिस विल बी एन illegitimate child, right? Second is a posthumous child. What is a posthumous child? A posthumous child is a child who gains birth within 280 days of the death of his father, provided that the dead father impregnated the mother. राइट। यानी कि एक फादर ने मदर को इम्प्रेग्नेट किया और उसके बाद में फादर की डेथ हो गई, एंड देन विद इन 280 days of his death the childbirth happens. In this scenario, the child which has taken birth now is the biological offspring of the father. So this child is going to be a legitimate child. How about birth following an artificial insemination? Artificial insemination को जब हम common language में बोलते हैं, it is the uh, semen of a donor which is being injected into the female genital tract for the purpose of uh, conception. यहाँ पर भी the father is not the biological father of the childbirth if it happens, which means even artificial insemination के बाद जो delivery होगी, that child will be called as an illegitimate child to the father. Again, I'll stress upon this fact, the issue of legal legitimacy is whether the child is higher to the property of the father or not after birth, right? Which means all children are legitimate to a male except supposititious child भी illegitimate है, और artificial insemination के बाद भी illegitimacy का status है. Correct answer is both A and C, right? Okay, अगला क्वेश्चन देखते हैं अब. A victim of rape is brought to a doctor's clinic. She has multiple general body injuries and genital injuries. Okay, so we have multiple general body injuries and genital injuries. She is a victim of rape. What is the correct sequence of actions the doctor should take? Now, जब भी हम इस तरह के किसी क्वेश्चन के पास आते हैं ना, consider remembering a very important legal provision. CRPC 357C, and it says rape victim mandatory first aid and treatment. Report to police. So if there is a rape victim which comes to a doctor, according to the provision of 357C CRPC, a doctor mandatory has to provide the first aid and the best treatment he can, and then report the scenario to police. वो उसको बिना रिपोर्टिंग के नहीं छोड़ सकता. करेक्ट. तो ये तो लीगल प्रोविजन है, राइट. नाउ क्वेश्चन में क्या पूछा हुआ है, व्हाट इज द करेक्ट स्टेप ऑफ सीक्वेंस और करेक्ट सीक्वेंस ऑफ एक्शन द डॉक्टर शुड टेक. द करेक्ट सीक्वेंस ऑफ एक्शन में चॉइसेस क्या क्या हमारे पास देखें. सबसे पहले इंफॉर्मेशन टू पुलिस, अर्जेंट ट्रीटमेंट, एग्जामिनेशन एंड एविडेंस कलेक्शन. और अर्जेंट ट्रीटमेंट, इंफॉर्मेशन टू पुलिस, एग्जामिनेशन एंड एविडेंस कलेक्शन. Information to police, examination and evidence collection, and then do the urgent treatment. Or last is evidence collection and examination, information to police, then urgent treatment. So what do you think is the correct sequence? So if you read all the things correctly, the correct sequence is option B, because CRPC 357 say the first is mandatory first aid, urgent treatment karo if there is something which is required to be done urgently so that the patient is comfortable and it requires immediate attention for her body healing or any other fact, do the urgent treatment, don't deny it. Then second is inform the police and simultaneously proceed on to examination and evidence collection for the crime that has happened on her. So it is also the duty that you do examination and evidence collection. So correct sequence will be urgent treatment, information to police, examination and evidence collection. Right? Okay, let's move to next question. A female is cooking at home. Her clothes mistakenly catches fire. Her left hand and forearm, left chest and left side of abdomen are burnt. What is the correct statement regarding her burns? The statements are: she has sustained 15% flame burns, she has sustained 14% scalds, she has sustained 20% flame burns, or she has sustained 18% of chemical burns. So, what is given very clearly in the question is she is cooking at home, which means uh, she has caught fire on her clothes, which means that it is not a case of scalds, because scalds is burns from wet fluid or steam. So we're not talking about hot fluid or steam here, and it is not a case of chemical burns. So it's not an alkaline or an acidic burn, right? So what are we remaining? Are two choices of flame burns. So दो choices तो बड़े simply आपने eliminate कर दिए. Now, what is the concept that is very important in the question? This concept has been asked. This concept is very easy, but it has been asked time and again in the examination. This concept is ability to calculate the percentage of burns. A student should know while he is practicing, or a doctor while practicing as a medical officer, if he comes across a case of burns on the body, he should be able to calculate the percentage of burns present on the body, and that calculation is given by a rule called as rule of 9. So we should know what is rule of 9. Rule of 9 says that there are 11 different body areas. All of them are 9% of the total body surface area. Head and neck is 9, as you can see here, right? Front of chest is 9, upper back is 9, abdomen is 9, lower back is 9, upper limb is 9. So front of upper limb is 4.5, back of upper limb is 4.5. So upper limb completely is 9. And then front of lower limb is 9, back of lower limb is 9. So total 9, 11 nines, and 1% is given for genitalia. 1% is given for genitalia. That makes 100% total body surface area. Now, with this knowledge, if you are going to read the question once again, what do we see? What is burnt in that female is left hand. So it's given left hand and left forearm, right? Left chest and left side of abdomen. Okay, left side of chest and left side of abdomen. Okay, so let's see, if we go back to the rule of 9 picture, what do we see? We see that this is burnt, right? This is burnt, and then left side of chest is burnt, and left side of abdomen is burnt. Correct? So this is the burnt area. Now left side of chest which is burnt is 4.5%. That's not a problem. Half of the total chest. Left side of abdomen which has gotten burnt is again 4.5%. Not a problem. But when we say left forearm and left hand is burnt, how do we calculate that burn? Because we have said whole upper limb is 9, right? So when whole upper limb is 9, we need to be able to divide the upper limb into 3 portions. These 3 portions are like this. The upper half, okay, so if the back of the limb is 4.5, the back of the upper limb is 4.5, the upper half is 2, the forearm is 1.5, and the hand is 1. Same goes to the front of the arm also. The upper half is 2, the forearm is 1.5, and the hand is 1. So what do we see in the question is that hand is burnt, left hand. So left hand is, front is 1, back is 1. Okay. So left hand is 1. Then left forearm is 1.5 for the back of the forearm, 1.5 for the front of the forearm. It becomes 3. So total becomes left hand is 1 for the front and 1 for the back. Sorry, so it becomes 2, right? 1 for the front, 1 for the back of the hand. The total becomes 5. So 5% is involved in the upper limb, and 4.5% plus 4.5%, which is 9%. So in total it becomes 9 plus 5, that is 14%, right? So if you come back to our question, what have we seen? That the remaining two options are she has sustained 15% flame burns or she has sustained 20% flame burns. So the closest answer that we have is option number A. She has sustained 15% of flame burns. Okay. Remember, uh, this kind of question of calculation of burns, it may seem very simple, but these kind of questions do come in the examination, and I would recommend all of you. So before going to the exam, within your colleagues or groups, do practice percentage of burn 3-4 times in different body area involvements. Do practice it, right? Right. So with that, we come to the conclusion of part 2 of the series also. I'll see you in part 3, which will be released on the YouTube channel on the 18th of June. And I seriously hope that whatever we have discussed today, any of the concepts or maybe the question itself may appear in your exam, and you crack that question wonderfully, right? Bye. I'll see you in part 3. Bye bye.